I rise to ask the question number 75, 2022, under my name to ask the Minister for Education, Heritage and Arts and Local Government. Can the Minister update Parliament on the counselling services provided by the National Substance Abuse Advisory Council to students during this pandemic? Thank you, sir.
Thank you. I now call on the Minister for Education, Heritage and Arts and Local Government, the Honourable Premila Kumar. You have the floor, ma'am.
Thank you, Mr. Speaker, sir, and I also thank the Honourable Member for the question. Mr. Speaker, sir, our children have suffered immensely with the spread of coronavirus across the nation. Some children lost their loved ones, others faced emotional and physical abuse, neglect, cyberbullying, violence, and drug abuse. During this time, counseling services provided solace to heal their pain and suffering. Pandemic caused hardship to many families because of job losses or reduced hours of work. With children at home, restricted movement, and financial issues, it was a difficult experience for many families. When such situations arise, Mr. Speaker, sir, the impact is felt by our children as well. We were not alone in this. Many countries around the world had similar experiences. There are several reports by UNICEF, UNESCO, and the World Bank that document the impact of school closure and downturn of the economy on children. These reports showed that during school closure, children's health and safety were jeopardized, particularly with an increase in domestic violence and child labor. And the mental health crisis among young people it also reached unprecedented levels. Mr. Speaker, sir, National Substance Abuse Advisory Council, also known as NSAC, has been working closely with the Ministry of Education to provide training and workshop for the teachers as well as counseling and support services for students. The counseling services for students were provided by 4 divisional counselors, 33 teacher counselors, 913 trained child protection officers, and NGOs such as Medical Services Pacific, Empower Pacific, and Lifeline Fiji. Mr. Speaker, sir, during the 8 months of school closure, NSEC provided counseling via phone to the student clients. They also worked closely with the head of school to identify students who needed counseling. The counselors conducted phone counseling for 82 students and 2 teachers during the lockdown. During COVID, NSEC sent psychosocial support messages to students, parents, and community members through social media platforms such as Facebook and Instagram, with the assistance of DFAT and the facility. Mr. Speaker, sir, the psychosocial support information flyers were sent to schools to help the teachers to prepare themselves before students returned for face-to-face classes. In anticipation of the help that may be required by students when they return to school, NSEC, in collaboration with the Ministry and UNICEF, took advantage of the school closure and provided online training to 913 child protection officers. This was done to ensure child protection officers could provide immediate basic support to students and refer more challenging cases to NSEC and other NGOs. Mr. Speaker, sir, when schools reopened, the Psychosocial Support Services Program was developed for years 12 and 13 by NSEC. NSEC staff, along with the 33 ministry councillors and schools' child protection officers, conducted this support program. Students who needed individual help were also assisted through one-to-one counseling session. This psychosocial support services program was conducted in the first week of November when schools reopened for face-to-face classes. A total of 129 secondary schools were visited to provide psychosocial support services to 8,934 students and 680 teachers. Around 60 students and 7 teachers were assisted with one-to-one counseling. Mr. Speaker, sir, in 2021, A total of 316 students were counseled between January to December. All child abuse cases were referred to social welfare, and a follow-up was made by NSEC to ensure that the safety and welfare of these students were not compromised. Mr. Speaker, sir, 234 students received counseling from 4th January to 31st March 2022, when school reopened this year. According to the data collected by NSEC, the pressing issues identified with students were sexual abuse at home and in the community, which was reported by students, mental health issues and depression, where students inflicted self-harm because of the underlying negative emotions caused by the trauma they had experienced. Students reported challenges they faced from their own families, such as abuse, neglect, breakup, or relocation. Students using drugs in the school compound. And this was reported when I visited more than 70 schools during this period. Students displayed violent behavior in school. Some students were cyberbullied by other students on social media using vulgar words and sex-related clips. Teenage pregnancy also increased during the lockdown. While comparing data from recent years, the most common issues were violence, drugs, and cyberbullying. Mr. Speaker, sir, I thank NSEC staff, child protection officers, counselors, NGOs, heads of schools, and teachers for working together to protect our children from social and mental